Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Srikar Karanam, who is a board-certified emergency medicine physician and the owner of Revamp Hormone Replacement and Weight Loss, a small business based out of the Appleton area that specializes in bioidentical hormone replacement therapies and both medical and natural weight loss solutions. After his residency was finished, Dr. Srikar embarked on a personal health transformation in which he lost over 40 pounds. Through that experience, he discovered that there is a significant amount of conflicting information that people oftentimes need to sift through when on a wellness journey, and he wanted to give people better support and information. So while continuing his work as an ER doctor, he established Revamp in February of 2024. Outside of work, Dr. Srikar considers himself a foodie and loves traveling, hiking, boating, snowmobiling, and camping with his wife and 2 dogs. We recommend listening to this 4-part series in order as the content covered in the episodes do build upon each other. With Dr. Srikar's expertise, we are excited to help you feel informed into the sometimes confusing worlds of hormones, PCOS, weight loss, and more. So let's jump into today's conversation. Hey everybody, welcome back. We are here with Dr. Srikar. Welcome.
Well, thank you.
We're so excited to have you here. And as your listeners know, we like to start out each new guest with either a fun fact or a fun story, something fun that we're going to learn about them. And you have kind of a fun story to tell us because you've done some awesome traveling around the world. So why don't we start with that?
Yeah, so I love to travel. We usually take about 2 to 3 international trips every year with friends. So one of the things is with med school friends, we go every single February. We try to go somewhere international. So it's been 10 years running. We did take a break for COVID, but I don't count that a year. No one remembers that year anyway.
We've all blocked it out.
Exactly. But I guess one of the fun fact is, so in Colombia, people drink cocoa leaf tea, which is what cocaine is derived from. But we also use cocaine in medical field as well. But when we were doing whitewater rafting in Colombia, towards the end of it, we were just feeling worn down. It was a long day. And one of our guide gave us some tea. We're like, oh, this feels great. I was like, this like great green tea, flavored well. And we towards the end of the cup, I start feeling a little kick to it. I'm like, man, there's a lot of caffeine in there. And they started laughing because they thought we knew there was a cocaine derived tea or as a cocoa leaf tea. So I guess I can say I have experienced cocaine. I gotta say it's not in this country, so please don't report me. But it was a unique experience that I wasn't expecting.
Were you rafting then after that? So you were experiencing like the high of rafting while also being essentially on cocaine?
Yes, pretty much. So we did raft in the morning, took a break for lunch. That's when we got the energy pickup, as I like to say, and then continued rafting. I have to say the afternoon rafting was a little bit more different. It's a little bit more energetic for all of us involved.
Wow, that is a very unique story. Thank you for sharing that. I'm sure you have a lot of stories from all of your travels. But
yeah, I love traveling. It's great.
It's amazing.
Hilarious. So fun. Well, we also want to start with your story in general and just learning about how you became interested in the medical field in general. And then also, now that you've started your own business in the wellness industry, how you led to that. So let's start with, how did you become interested in becoming a doctor?
Yeah, so actually it's kind of somewhat late. So initially, I came to US when we were 12. My dad was an engineer, and that's the career path I thought I was going to take as well. So I went through high school, went to college to become an engineer. But as I started working in the engineering field, I realized it wasn't for me. I didn't have the personal connection that was really really missing. Of course, every single field is different, but most at that time, you had your coworkers that you worked with, maybe 3 or 4 coworkers, and that was it. I really was missing the social aspect of a career. So I wasn't satisfied. Then I started looking around. What else can I do that would really scratch that itch? And it kind of fell into medicine. Shadowed some of family, friends, and other doctors in the community, and realized, medical field is vast, and I could kind of pick and choose how I interact with people, and they all seem very satisfied with their career. The biggest thing for me was someone walks into your door, and within, either immediately or you go on this long journey with the patient, which doesn't happen in engineering. You don't get to go on a journey with somebody else. And imagine you go on 20, 30 journeys a day, and you get to keep in contact with the same patients again. So that really kind of made it clear to me that that's the right field, or at least it's a field I want to go into. So pursued my medical school, went to medical school in Florida, did residency in Mississippi, worked a little bit in Nashville and upstate New York, and then kind of slowly made our way back up to Midwest.
So this is where your family came to, is the Midwest?
So my family grew up in Cincinnati. It's kind of odd how we ended up. So I don't have any connection to Wisconsin whatsoever, but I have never lived in this region or this far up north in my life. So for me and my wife, it was once again another adventurous journey. We had, it was right after COVID. I was getting essentially burned out in Nashville. I wanted to get away from big cities as well at that time. And we started looking around, what's a nice area that we can, raise a family, start a family while not being stressed. And then another important part was I had to have an airport in town. That was like a critical component I can't go without. So I actually made a connection from somebody in town during one of my medical conferences, and they asked me to come check it out, and we kind of fell in love with the area. So we've been here for past 3 years and don't really plan on going anywhere anytime soon.
Yeah, awesome. I mean, it is a really great place to live and to have a family, but maybe doesn't, bring as much adventure to your everyday life as...
I don't know, I disagree with that. So I got to snowmobile for the first time in my life 2 years ago. That's a completely new adventure. Summers are phenomenal. Like, we don't travel in summer at all because we love hanging out on the lake, boating with family and friends, kayaking. And the food here locally, you have enough variety to kind of scratch any type of food you want, any itch. If you're craving Japanese, you can get it. If you're craving Vietnamese, you can kind of hit it. So I feel like there's like a good balance in this area of adventure, but having more relaxed lifestyle and easy way to get out of town if you want to.
Well, there you go.
Now, after residency, you went through your own wellness journey.
Yeah.
Can you tell us a little bit about that?
Yes, sir. So just kind of give a little background. In college, I was relatively fit. Once med school started, of course, you're spending 8 to 12 hours just studying. You have this emotional stress, cognitive stress, and also then you start, some people overeat, some people undereat with stress. I was an overeater. So I think when I started med school, I was probably 160. I think I ended up when I graduated, I was 220 pounds. So I kind of put on a lot of weight very quickly every year. And once the residency started in emergency department, I realized I'm getting out of breath just by the end of the day. It's no longer healthy. So at that point, I really kind of focused more on my personal health, took a step back and realized I've just been sacrificing my personal health to kind of get to professional goals. But then I realized how far back I fell personally. So at that point, I really focused on what to eat. It's a whole lifestyle change, how to exercise. And the biggest part of that is also, even as a physician, there's still so much education we don't get on natural foods that I had to learn on my own. It's just not covered in medical school because you worry more about what's wrong with the patient, not what's always how to keep them healthy. It's a completely different mindset. So that was a huge journey. So now I'm down to 174. So it's a huge process. Took me over, since 2019, really, or 2017 till now. So it took over 5 to 6 year journey process. So at that point, I really realized, even in emergency department, I see a lot of complications from being unhealthy, like heart attacks, strokes, all this, and even a lot of cancers. All this come from being unhealthy. So at that point, I decided, you know what? There's a lot of misinformation. I have experience in personal journey, and I can really help patients sort through not only the medical complications, but also the wellness journey all at the same time. So I decided to open Revamp.
Yeah, I love that
Awesome.
blend.
I love it.
Yeah, having a blend of preventative and proactive and wellness care mindset, but then also the side where you're trained, where you can help someone if they have an issue going on.
Yeah,
so that's
absolutely.
incredible. So now Revamp is focused on bioidentical hormone replacement as well as medical and natural weight loss. How did you pick those specialties specifically within the wellness field?
Sure. In the wellness field, I want to look at what's going to give me the biggest bang for a buck for a patient is what's going to give them the longest lifestyle, what's going to give them the quality of life, which I think is really missing. My personal philosophy is it really doesn't matter if you live up to 90 or 100 if you're bedridden last 30 years of your life.
It's quality, right?
Yeah, quality makes a big difference. I personally, and that's kind of the philosophy I kind of took off. And I also looked at what am I really good at based on my previous experiences and my education. I'm not really good at a personal trainer. I don't have many qualifications for that. I'm not a really good at food coach. I can give you the basics. But beyond that, I'm not really good at that. And then I realized what I can really contribute to my patients is more on the medical side and getting the blend in. And really, all the studies show that hormonal health is what gets you the long-term preventative care. And most of us, we start having medical issues once we start hitting 30s and 40s, as we can something always pops up around that age and just kind of snowballs. So what can I do to keep that from happening? And if you all look at it, everybody looks really healthy in their 20s, but like once you start hitting 30s and 40s is when they start putting on weight. What can I do to kind of help prevent that from happening? So this kind of helped me both the natural calling and what I would give you the longest quality of life as well.
Okay. So if we go to the basics here, can you explain what are hormones and how do they work?
Sure. So hormones will kind of split into men and women. They are relatively gender specific. Hormones in just a global sense is essentially how your body from one organ communicates with another organ. For example, everybody knows about thyroid hormone. So thyroid is a gland around your neck that sends a chemical that travels through your whole body, and it signals the rest of your body, your muscle tissue, your heart tissue, your GI tissue, on how to essentially behave. And that's your body regulates that really well. When that gets out of whack is when you start having problems. So that's just in general is how hormones are chemicals your body communicates with each other from brain down to your body up to your brain in a circle. The biggest one that we really work with and the ones that most people have issues with is the first one for men is what we call testosterone, essentially. So testosterone is a hormone. It's more in men than women. Both men and women make it. But as we age, men slowly starts declining. So for men, we essentially replace testosterone. Women, it's a little bit more complex. So women make estrogen, progesterone, and testosterone. They all kind of work in this synchronized dance, I like to say it. So every month, if you're having regular periods and you're not on any birth control, your estrogen and progesterone will fluctuate pretty high. It'll peak and it'll pretty much drop down to zero again. And as long as that's synchronized, you do really well. When they're out of sync, then that's when we start having problems. And for women, testosterone works same way as men. It starts on a relatively moderate level, and it slowly declines as we age as well. And we monitor those levels and adjust them as we need to.
So it's normal for these hormones to decline as we age, correct?
Yeah, it is completely normal. That's unfortunately biology. It happens in every single animal. And then that's why we get a lot of side effects of aging. For example, generalized weakness or more or less sleeping. We can talk more about that in detail as well. But as we age, every single organ tends to decline a little bit, and the glands, unfortunately, don't produce as much as they used to.
Do other hormones decrease as well? So we're talking about primarily sex hormones here, and that's primarily what you help with, correct?
Yes.
Do you help with other type of hormone replacements too?
Yeah, so we also do work a lot a bit with thyroid, and then when we talk about PCOS, we can talk a lot about one that's critical in a younger patient as well. And then actually there are quite a few hormones, like for example, people talk about the weight loss drugs, Ozempic. So GLP is also a hormone that gets secreted by your stomach that monitors your hunger. That will decrease with age as well. That's why people tend to kind of put on more weight as they get older. So they're quite, depending on how deep you want to get into which, there are quite a few hormones that we work with. But the most main ones, the global ones that affect people in their lifestyle is usually the sex hormones and thyroid hormone.
Okay, so let's start with the complex ones, the ladies.
Yeah.
Yeah. So can you explain to us, so there's perimenopause and then there's menopause. And I think for the general population, we're kind of like, oh, perimenopause is the step before menopause. But like, what's actually happening in each of those phases? And how do you know when you're in each phase?
Yeah, absolutely. So perimenopause is essentially a step before menopause. So for women, it's a very gradient scale. So I guess we can start with how menopause is defined as 1 year after your last menstrual cycle. So that's how menopause is defined as for any individual that's not on over-the-counter hormone replacement of any kind, or birth control, or haven't had any ovarian or GU surgery of any kind, or uterine surgery of any kind. So before that period is essentially perimenopause period. Usually starts around 35 to 36. It's also when your fertility starts going down as well in most women. That's why women after 35 is considered geriatric pregnancy at that point.
Which is just kind of a hilarious word.
I know.
I know people. Yeah, I like to tell people it's nothing against you. It's just biology. I mean, we can't. Yeah.
But they could have found a different term. Yeah, I mean, it really just sounds like.
But these terms are very old, archaic terms either. I'm sure that's probably more modern terms. They just haven't made it to the medical field yet.
Okay, well, you can relay that for us, right?
Yeah, absolutely. Okay. I'll set up from the next conference. The first thing that starts happening is usually in a female, the amount of progesterone that gets created starts decreasing. While that's happening, your estrogen, before it used to be this beautiful peaks during your cycle and then kind of goes back down again. You have this smooth peak. Now it's very erratic. It's almost like up and down, jagged. I call it like essentially chaos. Is when you're in chaos. So progesterone goes down, estrogen is in chaos. And this is when you can have like really very irregular cycles, night sweats, sleep loss. You feel very moody. I don't like using the word either, but I call it labile mood, where your mood can be really manic or really happy, and then randomly it will drop down to very sad, and you have no explanation. Like you start crying, and like, I don't know why I'm crying. It doesn't make any sense. It's also start having hot flashes. So all that starts happening in the perimenopause period. That lasts usually up to roughly 45 to 50. And usually that around that age is when you start not having periods anymore. And after that, you hit menopause. So it's a very gradient scale. But really, the biggest symptoms are in this perimenopause period where everything is chaotic. And that's when a lot of women that come to me also struggle, because now it affects their lifestyle, it affects their job, it affects their relationship with their family members or friends. And they're like, I don't know what's going on. I need some help. And then they think they have a psychiatric issue, which they may not, because they'll fall into depression, like a true depression, and they don't know why, because they never had any psychiatric issues when they were younger. It's also one of the reasons, really progesterone swings are also one of the reasons why people can have postpartum depression, is because they have high progesterone. When they're having their baby, they give birth, and their progesterone just drops off. And now they have this huge depressive state that takes, unfortunately, can take up to 6 months to kind of bring it back up again. So unfortunately, it's all this chaotic period is what perimenopause is. Menopause, once you stop having your period, you don't have these chaotic symptoms as much. Things tend to even out more, but you don't feel great again. You feel like you're having body aches. It takes long to get out of bed. You lose your muscle strength. It's also when you start getting osteoporotic. You fall, you can break a hip. So like that's pretty much the menopause. It puts you at high risk for heart attacks and strokes. So that's it's not chaotic anymore, but it's still not a great place to be in general. For men, it's a little bit more gradual. We call it andropause. There is not like a clear-cut, defined definition like it is for women for menopause. Essentially, testosterone slowly starts climbing down. And with that, the biggest one, the men come from is their sexual libido goes down quite a bit. But then there also affects their personal relationships with their wife or significant other or their spouse. And they notice that now when they sprain their ankle or fall, it takes before you used to heal within 2 days, now it takes them a month to recover. So the recovery goes down, the strength goes down. So all that takes place.
Does andropause start around the same time frame of life? You said perimenopause can start around 35, 40, somewhere in there. Is it the same for men?
Yes, it's usually about the same 35 to 40. That's why, men start at that point. The biggest thing they really notice is the sexual desire goes down or the libido goes down. So that's when they really kind of get clued into it. Usually starts a little bit before that, but people don't really pay attention to anything else beyond their personal relationships. That's like the biggest factor in their life, right? To be emotionally healthy. Yeah.
Okay, so you had said two things about women. One of them was with pregnancy, with postpartum depression, right? So the progesterone gets affected with that, so it goes from high to low. Is there something that women can do or for, maybe like preventing postpartum depression if they know they get it, or like, can they do something with their hormones, even the postpartum period?
Yeah, so it also depends on train of thought you're following. I always recommend getting your OB involved in the initial conversation as you're getting up to your delivery time period. Say, look, I have a history of postpartum depression, especially if you know you had it with your previous pregnancy. What can I do to help prevent that? The main course of treatment right now is essentially put you on antidepressant medications, SSRIs, serotonin receptor inhibitors, and that can really help with the symptoms. There's a new thought process that's coming along quite a bit as well, and there's a good studies published it that says if you can replace the progesterone to a high level and then slightly titrate them off to a lower level, that can help quite a bit as well. Once again, it's not rigorously studied, so I'm not sure how much of it is by personal bias versus how much of it is actually what can truly help. Talking to my colleagues all the time about this, about the space hormone replacement in general, and I have quite a few colleagues who do that. If a patient comes in and says, "Look, I feel depressed and they're postpartum," they put them on a high-dose progesterone and it seems to work phenomenally well. But I always recommend getting your OB-GYN involved because it can potentially change how you produce your breast milk, a few other things in the pregnancy process. So it's a conversation that pretty much takes the whole village to kind of work out.
Okay, and then that's great. And then the other question I had was, you talk about perimenopause starts around 35, 40, and we can't stop the hormones. Like, this is a natural thing that's going to happen to all of us, but how our bodies and how we handle it, I guess, throughout the process and balance it is important. Is there a way that we can naturally, or like in your 20s or before perimenopause, kind of help balance your hormones before it gets all crazy?
Like set yourself up for success.
Yeah, absolutely. Right. Actually, honestly, the biggest thing is really getting a regular exercise, especially really pushing yourself to where you're sweating 3 to 5 times a week tends to just really optimize those hormones quite a bit. Another biggest fun is also natural diet. I don't really get into specifics about, you eat a lot of soy, don't eat a lot of soy. It's usually in that area, you just want things to kind of normalize. Your body has a very good way of adjusting things when they're too high and adjusting things when they're too low. So you want to give it enough, stuff from outside to really help with that. The best thing we can really do is exercise regularly, eat healthy food, whole foods, natural diet. That's always. I'm a big proponent of that. That tends to even things out as well. And then really the other one's also relationships with your family and friends. Mental health is a component of this because hormones affect mental health and mental health affect hormones. They go back and forth. So having that healthy relationships, whatever that looks to you personally, is very critical in this period as well.
Yeah, I love that you bring all that together. And I know we're personal trainers, so we are huge advocates of strength training. And that's huge, something we tell people all the time as well.
Yeah, especially women. Actually, a lot of women that come to me, they don't strength train, so I have to push them. And once they start strength training, they notice, hey, things actually feel a lot better. It's not just cardio. Cardio is great, but you need the strength train. This is kind of going a little bit off topic, but really once you get up in age, if you break a hip, statistically, there's a 50% chance that you're going to die within the next year. Yeah. Because of so many other complications that happens. And the biggest way to prevent that is increasing your lower body strength. And there have been so much research into exercise physiology that really shows the highest predictor of your quality of life and being independent as you get older is really lower body strength. So it's not even really cardio, it's the lower body strength that really, really matters.
Well, and it's not just, starting lower body strength training when you're 55 and you're already, at risk. Yeah. It's like, this is lifestyle. So this is when, especially as, families, and a lot of our listeners are moms with young kids, and their time frame for themselves is very minimal. But this is where, man, if you're going to be doing fitness, strength training is where you need to be.
Oh, absolutely. I mean, your muscle mass starts going down after you hit 20. 20 is your peak, maybe 23. So after that, it's all downhill. But that doesn't mean you can't prevent them from getting worse.
Right. Yeah. And you can always start too. So even if you haven't started weightlifting, do it.
Yeah, do it.
And exercise and diet and everything else.
And you guys have connections with personal trainers. And that's one thing I also connect my patients with personal trainers. Like, all right, you got to get you into strength training. And it doesn't have to go to a gym. You can do it at your home. You can do it with low weights. It doesn't have to be intimidating. We just need you to start the process. And once you start, no one stops because it feels amazing.
Well, this was a really good first episode just to kind of give us an intro into like what are hormones and how, it's natural for hormones to decrease for men and women as we age. So you specialize in bioidentical hormone replacement, which we're going to dive into what that looks like in the next episode. But before we do that, you are offering our listeners one free 3D body scan with accurate measurements. Can you explain a little bit about what that promo is and what they would do to contact you to receive that and just what that actually means?
Yeah, so we have equipment called it's called Styku, STYKU. It gives you a 3D body scan and it uses radio frequency, so there's no radiation whatsoever. It's the same stuff that you use to turn on your TV remote, but it gives you a 3D picture from head to toe. It's within an accurate of 0.4 inches. It's even more accurate than that. That's on the maximum end. But it actually gives you a good idea on all your measurements, on all your body parts. And with using artificial intelligence based on your height and weight, we can also break it down to how much bone mass you have, how much muscle mass you have, how much visceral and subcutaneous fat you have, which is a different conversation all in general because those two mean completely different things. It's not just fat as a whole. And then you can do the scan as many times as you want as well. Since there's no radiation, there's no limit. A lot of my patients do it about every 2-3 months. It's great if you're trying to put on muscle, and it's also great if you're trying to lose weight. Then we can really watch progress. That way you have accurate measurements. It's not just looking in the mirror or taking a picture. A lot of times weight itself doesn't tell you a story, right? If you're doing, as you guys know, if you're doing body recomposition, you might be the same weight, but your muscle mass goes down, your fat percent goes down, but your scale won't change. So I'd really, really encourage all my patients to do this. That way they don't get discouraged, that they can see actual progress that's accurate.
Right. Yeah. And then they can ask you questions too.
Absolutely.
So how do they contact you for
So the best way to do is go to my website, RevampHRT, RevampHRT.com. On the button, it says make an appointment. So just make an appointment. And that's how you make all my appointments as well. Has my calendar open, and then we'll just see you in the clinic and kind of walk you through the whole process. And really, after the first time, once I teach you how to do the scan, you can pretty much walk in during your open hours and just do the scan yourself. It's really not too difficult.
Oh, wow. Okay.
Cool. But I feel like that would be a really good baseline for people to do, just to do a check-in on where they're at and what their body actually looks like on the inside. Because as intelligent as we are as humans, we don't have a computer system on the inside that tells us what's going on. Yeah. So I feel like that would be really helpful.
Yeah, and having a progressive scale, because you can compare from every single scan, you can compare them next to each other with the measurements. So it really tends to put things in perspective and really show the progress quite a bit.
Right. And they can ask you questions. And,
absolutely.
They can figure out if there's a plan, if they need to do something.
Yeah. And then you also get a 3D printout to take with you. So you can actually work with your personal trainers, be like, hey, I need to focus on this muscle part to get you more balanced. And that can really help quite a bit.
I love that.
Yeah.
I love it.
Yeah, that's great. Well, this was, like I said, it was a great first episode. Next, we're going to be talking about all things hormone replacement. So make sure you stay tuned for that one, because it was great that you provided us some tips on some natural things you can do to set yourself up for success, as we know aging is going to happen. But the next episode is going to be great for those of you who are wondering what additional things you can do as well. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.